Hi, so this entire video is going to be about my surgery, the before, the surgery, and then the after. I got surgery February 14th, and we're currently March 3rd, so it's been more than 16 days, and so I'm going to be talking about all of that. I'm going to put the type of surgery that I got right here, since I do not pronounce that in English. I know it in Spanish, but I don't in English, so I'm going to put it right here. But essentially I got 3 incisions, one in my belly button, one like a little below my chest, and one on the side. What it is that they just they pump you up with gas, so your abdomen, stomach, chest area inflates, and so they can just go and get your gallbladder and just cut it out and just pull it out. So that's kind of the surgery essentially. Obviously it's more complicated. I very much summarized it in a very generic way. So we're going to talk about the before first. Now, I got my appointment with my surgeon, and talking about it, he was like, okay, from a 10, how painful is it? I was like, it's 10, when it's really painful. And there was the surgeon, and I don't know if she was like an assistant a surgeon or like a nurse. I don't really know. I don't like medical titles. I don't know, but she was like with him typing on the computer, and she was like, oh, it'll probably be 2 months. And I was like, I was kind of let down by that, because I was like, oh my god, it's such a long time. And he told me like it'll be a month, and so my mom was like, really, that long? But like in my mind I was like, a month seems reasonable, because you have to get tests, you have to get the surgery approved, you have to get appointment with the anesthesiologist, so like it kind of made sense. But my mom, she wanted the surgery quick because she wants me to feel better. And he was like, if I were to send her to the ER, they're gonna leave her there for 4 days, and it'll take for them to do all the tests, and it'll be more painful and more comfortable instead of her just doing it on her own time. So I got sent blood work. I only got sent blood work, and essentially they gave me like step-by-step things. So I had to go get a blood test, and then I had to call to schedule an appointment with an anesthesiologist. After the appointment with the anesthesiologist, he gives me like the go ahead. He's like, okay, you're good for surgery. Then I go, and then I request to schedule the surgery, and then you have to pay for the surgery, and then you get called for when you're gonna get the surgery. So that's like the process. So when I went to go get my blood work, obviously you have to go with no food in your system, because it's like an 8-hour or 10 to 8 hours of like no food. And so, and no, you can't also go out, you can't drink, just the normal things. And so there were 2 things that I had like out of the normal range, so I'm going to put them right here. Essentially it made sense why, because they're associated with like white blood cells, and there was something like foreign in my body. Even though my body made it because it was gallbladder stones, it's still something that is making the gallbladder like its job, making it more difficult. So it makes sense why my body had certain like things that were out of range. But other than that, it was fine. And I also took advantage of the fact that I had to get blood work, and I got my for my thyroids, which is a TSH, which is TCH. It checks like your thyroid levels. Anyways, that has nothing to do with this video. And I'm not good with blood work, even though I was sick for a long time, so I would get blood work a lot. It had been such a while since I have gotten blood work, so I was kind of like, but moving on. So after that, that was on a Thursday, I think. That was on a Thursday, and then I ended up calling an anesthesiologist on Monday. I actually went to the hospital to get an appointment, and I got the appointment for like maybe a week later. Like the appointments was like days later. Like I thought they would take like months. No, it was like days later. And I'll put the dates so I can remember, so you can kind of see how long the process took. And during my anesthesiologist appointment, I actually got there an hour before, because my parents were nervous. They didn't want me to lose like the appointment, and he was running late. So anyways, so we sit down. He asks me like, okay, what are you allergic to? Have you had previous surgeries? Do you have other illnesses? What medication are you on? Do you suffer like from shortness of breath? Do you get like kind of choked up? And do you drink? Do you do any drugs? And he checked my blood work, and he was like, okay, you're good. I am asthmatic. My last asthma attack was when I was like 8, and so when I was that young, you know, I'm 23 now, they told my mom that for future surgeries, she had to tell the anesthesiologist that I was asthmatic because they give you another type of, you know, anesthesia. But now, 2 doctors have told my mom that doesn't matter. So obviously things change, medicine changes, so it might have changed, or maybe it just has to do with the fact that I haven't had an asthma attack since 8 years old. But I still tell I still tell the anesthesiologist, I still tell the doctors that. So my mom was kind of like worried when he said like, oh, it doesn't matter. And my mom was like, okay. But I am allergic to certain medications, so he also put that on the thing. And then he was like, okay, go to this is the clinic, right? It has this other section. Just go to this other like building, like right next to the building, another like mini building. And just go and get your appointment. So I get there, and there's no one sitting at the desk, so I see one says authorization and one says surgery. But in my mind, I was like, oh, I'm authorizing for the surgery, and that's what I have to. But thankfully, I picked both, so I got both tickets to like wait for my turn. And the authorization one, I went up to, she's like, oh no, you need the surgery one. Thankfully, I had that. And she's like, also read the wall, because on the wall there's some information. And essentially, I had to get a photocopy of my ID. And it said only photocopy of ID. But my mom got nervous because another man was getting photocopies of everything. So for my mom to have like a peace of mind, I just told her, just photocopy everything. She told me to stay and wait in case I got called. And she like got here before I got called. I went up, and they were like, okay, we're gonna wait for like there's a woman who like tells you how much it costs, obviously depending on your insurance and all that stuff. And she's like, we want to give you the right amount, and you can pay it now or you can pay it later, but you have to wait for that. And she was like, okay, we're gonna give you like, when is your surgery? So initially I got that my surgery was gonna be the 13th, but which I was so nervous because my surgery was supposed to be at like 1 p.m. and it was like 8 in the morning, and I was so hungry, and I was like, I don't know how I'm gonna make it till 1 p.m. But thankfully they canceled and they rescheduled it for Friday. Or was it Wednesday? I don't remember. My surgery was Wednesday or Thursday, and they scheduled it for Friday, and that was good because my surgery was supposed to be at 8 in the morning, but it ended up being at like 11. Things happen. So anyways, back to what I was saying. So yeah, I get my appointment, I pay for my surgery, and then they're like, okay, you can go home. They give you a consent form, which essentially is saying like what you could possibly get. So it has like sepsis, like all these other things that can stem if you have a complication in your surgery, and basically giving them the permission to do any other procedure to help you. And so I remember when I read the fact that it said sepsis and death, and I was like, you know what, I'm not gonna read that yet. But I signed it, and that was it, right? And then I was like, okay, cool. We're I'm ready for this. I was nervous, but I wasn't nervous. I was nervous for the IV, and I was nervous for the after. The during, like the falling asleep, the surgery in itself, I'm chill with that. So that was the before all that, and now the day of the surgery. So it also was 8 hours without no food. I was only allowed to drink a little bit of water to take my medication, because I do take medication for my thyroids, and that was it. And they also asked you to bring in like a personal hygiene items, which when they told me that, I didn't know what to bring. So when they called to confirm my surgery, my mom asked, and she was like, oh, a towel, a toothpaste, and then it like dawned on me later that I was like, oh, that's in case your surgery has complications and you have to stay overnight. But, so I brought like a huge bag with all the stuff that it said, and I also brought, I don't have him with me, but I have a little piggy. I brought him. I didn't take him out because I didn't want him to get like, you're still at a hospital, there's, still people who are not well. And anyways, so we get there at 7 in the morning, because the thing is, when my surgery was at 1, the previous surgery that I had scheduled, they told me to get there an hour before. So she told me get there at 8. So in my mind, I was like, oh, 8, the surgery's at 8, so get there at 7. She didn't say to get there at 7. She just said, oh, it's at 8. So my brain was like, oh, get there at 7. No, it was at 8. So there was no one, and I was kind of nervous because I didn't want to lose my surgery. I didn't want to, even though I obviously if you have a surgery, you know, scheduled, the surgeons are just gonna be like, oh, she missed it, well, moving on to the next one. But in my mind, I was like, oh, maybe they won't know I'm here, maybe they think, you know. And we were waiting, and then someone else was like, no, just wait, sit down, they'll call you. And they called me at like a little bit after 9:30, I want to say, like 9 to 9:30. They called me and my mom, and we went, and they give you to change. So at first I kind of noticed that, you know, because I was wearing like a gown, but they give you like shorts with like mesh, and I saw that my gown was a completely different material than someone else's, and I was like, maybe it's different surgeries. Come to find the realization after I was waiting in the recuperation area, I was like, oh my god, if you're a woman, you know, you have a different chest than a man, you get a thicker gown, and if you're a dude, you get a very like thin, flimsy gown. And I was like, oh, that makes sense. Anyways, so you change into that, and you get like little booties, you get a hairnet, and then you sit in, you know, in a waiting area. And it was divided by genders, but there were a bunch of men in the women's area. They didn't really notice, and there was men who were very confused. They didn't like. There was this man who was getting I don't want to say what surgery he was getting, because I don't know, if like maybe that's in a, like, you know, privacy, but he didn't know what type of anesthesia he got before, and his wife, and you can only have one like companion. And this man had his wife and his son, and I was like, how did this happen? Like, what? Okay, so anyways, I'm waiting. It's taking a while. My mom sees the surgeon, and the surgeon is like, oh yeah, we're waiting for things. We're like, you know, things are happening. And apparently he operated on 11 people that day. I was one of the 11. And supposedly it was going to start operating at 8, but everything kind of moved back. I don't know why. I ended up getting surgery at 11:30. And so I hadn't eaten for more than 14 hours. Like, my stomach was empty. And so my mom told the nurse who was like, you know, writing everyone in, giving you like kind of a different type of consent form with your initials, your like ID number, and then she was the one who put the needle. And so my mom was like, look, she hasn't eaten for like 14 hours, she's getting dizzy. And so she gave me retinol, which essentially kind of like, I have no idea what it does inside you, but it makes sure, because I have gastritis as well, so 14 hours, it's gonna trigger gastritis. So they made sure to like keep that under control. They also put an IV to like feed you, I guess. I didn't know that was feeding me. I was like, I don't know what that is for, but okay. And so here goes the part of getting the IV. You can't tell. You can kind of tell, not anymore. It's right here, the last part. I will post pictures, but essentially, she put the needle through here, and my vein just popped. I started crying because it was painful, and obviously, I don't know why, when I always cry, I don't cry because of just, I cry because it's painful, and people, and the doctors or nurses are always like, oh, you know, you're just such a, like, you know, you're just so, like, coddled, and I'm like, I get, you know, my mom's here with me, and she's very like, oh, are you okay? But like, it hurts, man. So it was in pain. Started crying. It was inevitable, because and I had gotten, like, for another procedure, my colonoscopy, I got colonoscopy, because they were also trying to make sure they didn't have anything. Anyways, for that procedure, my vein also blew up. So that was also painful. Anyways, so this one blew up. And she was like, look at it. And I was like, I'm not looking at that. I don't want to see it. So she takes it out. And the thing is, she's like, unfortunately, I can't use a small needle, because it has to be a long needle, and has to be like, you know, because a lot of medication's going to go through it, and blah, blah, blah. And then she tries here, doesn't get it. And then she's looking at here, and she can't find it. And so she tells another nurse, like, hey, I really love that for her. Like, I love that she did that. She didn't try to be like, oh, I can do it. No, she was like, I don't want to put her in more pain. Can you please find I couldn't do it. And so the other nurse comes, and she just starts hitting my wrist, what is this? This part of the hand for like a minute, and it's obviously it hurts a little bit, because obviously this is a very like sensitive area. And I was seeing that she was checking this out, and I have gotten an IV here before. It's the most painful. Like, I said, like, the procedure that I got, she ended up having to do this one, and she was like, it's the most painful, I'm sorry. And it felt like I was being stabbed in my bone. So when I saw her, like, checking out these veins, I was like, please don't, anything but that. But thankfully, she found it right here, didn't hurt, and it was good. And so the nurse who accidentally blew up my vein, she obviously got me an ice pack, and she got me a thing that said, like, that I was a risk of falling, but she said it wasn't because, obviously they usually do that for people who are older, but she said that because I haven't eaten in such a long time, we're gonna put that on you. And also, like, a orange one that says, like, the medication which I'm allergic to, which I won't say because I feel like that should be classified information. So yeah, unless I've already said in other videos, who do I know? But yeah, so they also put that right here. And then she's like, okay, just keep that ice pack on you. I go back to, like, the separated area where all the men are, but it's supposed to be a women's area. And I was having, even though I was waiting and waiting, I had fun because there was a lot of patients coming in and out because they were also having other procedures on, like, the surgery ward was here, but they were also having, like, procedures where people are getting, like, things in their noses. I have no idea. And there was this 80-year-old woman. She was so funny. She was like, she was just so funny. She was really great. And, you find a lot of funny people, and so you're not there, like, stressed out, right? There are other people who are just creepy. But, so, I'm waiting, and then maybe, like, an hour, half an hour later, they're like, okay, they call me, and my mom is like, and at this point, even though I have an IV, I'm like, can I please go to the bath? No, she tells me, do you have to go to the bathroom? And I'm like, I think I do. And she's like, okay. And she's like, she puts the IV bag on the top, and she's like, okay, do not tear it because it will tear out of your skin. And I'm like, oh, chill, I won't do that. So I go to the bathroom, I come out, and she's like, okay, I am the surgeon's assistant. And so my mom's like, take care of my daughter, and she's like, of course we will. And my mom's like, no, you will, because you're the point of, my mom's, obviously, I'm, like, the youngest, I'm the baby, even though I'm 23, I am the youngest of all of them. And so I give my mom a kiss, and then she, like, walks me to the surgery ward, the OR. And as I'm walking there, I'm obviously very nervous, and I see there's this OR that's the doors open. There's a man just laying there, and I'm like, maybe is he sleeping? Is he a patient? But anyways, they keep on walking me, and then my operating room was, like, the last one, and I get there, and this anesthesiologist. Oh, I forgot to talk about the anesthesiologist. This is one. He was a different one. He wasn't the same one who gave me appointment, because he told me I usually don't do operating. I'm not in the operating room. I'm just out here. And so this one was a complete different man. But I'm fine with it. I put my trust in medical professionals, even though I've been, but I put my trust in them. And he was like, why do you have an ice pack? Why are you such a baby? And I was like, because it hurts. It hurts. Anyways, he was funny, and he was like, yep, I'm responsible for you. I was like, I'm allergic to this. I'm asthmatic. And he's like, we're good. You're good. And so when we get there, he's literally listening to music and seeing what he's gonna put on his Spotify for the surgery. And then there's another woman who she's in charge of, like, the instruments, the tools that's gonna be used on you. And then the surgeon assistant, she introduced me to everyone by name, but it just went all over my head. I was so nervous. I was, like, freaking out inside, right? But I was trying to be calm as well, because my previous surgery, my mom unfortunately freaked me out too much, and so I went to sleep, panicked, and I woke up in a panic attack. Like, I was hyperventilating, I was taking off my mask, I was yelling and crying that I didn't want to die. So I didn't want that again. So I was like, just try to be as calm, take deep breaths. And another man was there. I think he had to do with the machines, because I didn't know, but later when I was sitting down in the recuperating, I would see him bringing in machines and bringing them out. So I think he was in charge of that. But so she asked me again, like, what's your name? What is surgery you're getting? What are your allergies? Do you have other illnesses? Kind of to, like, confirm, right? And so there's, like, this little donut, and it's wrapped in, like not plastic, but you know what I mean? It's right there for your head. So she's just like, okay, lay down. And I lay down, and before I lay down, she takes one of the sleeves and puts it under here. So she's like, just hold on to it, right? So I can just, like, take it off in your surgery. So I lay down, and she straps me like Jesus, like, arms out like Jesus, crucified, I guess. if it wasn't obvious. And so she puts the strap thingy bob to check your pressure, and she's like, that's just gonna be on you for like, you know, the whole surgery. And I don't remember which hand she put on the heart monitor thingy, and then she strapped this arm. I think she strapped both of them arms. I don't know, maybe your body involuntarily twitches when you're asleep. I have no idea. So I'm there, and the anesthesiologist doesn't really say anything. She's the one who's talking to me, and I just feel this burning sensation in my arm. Like, my arm physically moved. It hurt so bad. I could feel it going all the way up here, and it like stayed here. And she was like, oh yeah, sorry, that's the anesthesia, or whatever, the chemical, I guess. Even though that's how she told me, like, explained it to me, even if it was, you know, had a different name, she's just gonna refer it to it because that's what I would know, you know. You dumb it down for the people who don't know medical terms, basically. And it feels like you're gonna pass out. It's very uncomfortable. I always hate it because everything kind of starts slowly moving side to side, and your hearing just starts, it's essentially like how you're gonna pass out, and your hearing just starts going out. And then you feel this pressure on your head, and I felt my throat closing up. And I didn't let myself freak out because I was like, you know what, there's medical professionals around, the anesthesiologist is around, he will know what to do, I'm fine. And then I didn't even remember when I went to sleep. But if you don't know, when you're in surgery, usually they put a tube down your throat so you can breathe properly, and so there's not anything going into your lungs and everything. So if you didn't know, they usually do that. And so obviously, because my throat closed up, I felt it closing up. Obviously, when I woke up, my throat was very just... So now the waking up part. When I woke up very disoriented and in pain, because obviously when you're asleep, your body doesn't feel anything, and then when you wake up, your body's like, what the heck is happening? The pain lasted, the concept of time wasn't really, but I felt like it maybe was a couple minutes where I felt the pain, and then it kind of chilled out. I was very cold because I hadn't eaten. I was freezing, and I had a blanket on top, and I was still freezing, and I had a oxygen mask, and my head would just move, and I knew it was moving because I could feel it, but I couldn't open my mouth. I couldn't talk, and it was just moving, and I could see the clock, and I saw that it said 12:17. So I went in at like 11:30, and I came out like 12:17. So it was like 40 minutes or 45 minutes, and I don't know, math. And so I'm laying there, and I'm trying to like kind of, everything is just fuzzy and cold, and I can't speak, and I want to tell the nurse that I'm cold, but I can't open my mouth. And they roll in this man. This man is screaming bloody murder, saying it hurts, it hurts. He's literally, I can see him in the corner of my eye, and he's like pushing himself up from the bed, from like the bed. I'm gonna call it the bed. And he's moving, and the nurse is telling him, you need to calm down, you're gonna hurt your vocals, you're gonna fall off this bed. And he's screaming bloody. Someone else is like, dude, handle your patient. I find out he got the same surgery that I did. Some people have low pain tolerance. Very low pain tolerance. Like, very low. Anyways, so they keep me there, and then finally I slowly regain function of like my hands. I can move them, I can like feel them, I can open my mouth. And then there's a nurse who's walking around checking each patient, and so I didn't even see her, and just out of nowhere they just lift my oxygen mask, and I'm like, what? And then she's talking to me, and I'm like, and all I can say is I'm cold. I don't even know if I could say a complete sentence. I just said cold, and she's like, okay. And so after I kind of mellow out, she moves my bed to this other area. They had like this kind of like a box where it has a bunch of medicine and like medical stuff, and it says caution, very hot. And I'm like, she was so nice. Like, she literally, even though it didn't help, I was still freezing, just the fact that she did that was very sweet. And I thought that they gave you like, because for my previous surgery and this surgery, they gave me mango juice, because you need to have juice after you have to, like, I don't know the medical reason so I'm not gonna pretend I do, but I think it's just to like get something in your stomach so you have a little bit of strength. That's my logic. And some crackers. And so because I was like, oh, that's so nice. So I'm eating my juice very slowly, because if you drink it fast, you will throw up. It and you don't want, you just out of surgery, your body's still like meshing together. You don't want to be throwing up. You just don't. No. Follow your nurse's instructions. Just follow them. So when she gave me the go ahead to drink, I drank very slowly. I ate my crackers very slowly. And then she was like, okay, we're gonna, stand you up and we're gonna move you to sit down on a chair. And so I'm sitting in a chair. I'm like the youngest. At that moment, I'm the youngest. There's a man next to me, the one who was screaming bloody murder. Another man next to me, and I'm just sitting there like eating, and they haven't eaten yet. I'm there by myself for a while until they arrive, and that's when I noticed he has the same juice that me, so I'm like, oh, the hospital gives us juice. I didn't find out later that it's actually your companion who's outside, aka my parents, who they go out and they're like, okay, companions of, Janine, can you go buy juice and crackers so we can give it to her? It was I wishful thinking on my part that the hospital would give you juice. But yeah, I sat there for like 6 hours because they keep you sitting there to like keep you on watch to make sure that everyone's fine, that you don't bleed, that you don't anything, they just 6 hours in a chair. My butt hurt. I napped a little bit. I just sat there. The dude next to me, he told me his life story, so I was kind of like, yeah. But the thing is, they recommend when you get this type of surgery to not talk because you're filled with gas. So if you talk a lot, you just fill it more with gas. So you need to like, burp or exactly to get the gas out of you. And I had this huge pain right here. I don't know if it was the gas or the anesthesia or both, but it was so, like, this pain was way worse than the pain that I felt on my surgery wounds. Exactly. And so, yeah, it was just 6 hours of waiting. Like, the nurse, she was super sweet. She would come, she would talk, and because they have, like, heart monitors everywhere, one of, like, the pressure thingies almost fell on my head. But yeah, it was pretty chill. There was a lot of people in and out. There was because it was very cold, and out of nowhere I started feeling like a little bit warm, and I was like, is this, I'm just not nauseous. I was like dizzy a little bit, so I was like, I don't think this was enough to like make me warm, crackers and juice. And apparently the air conditioning just failed, and this surgeon came out drenched. He looked like he had run a marathon, and so they were calling maintenance to come fix it. And it was, a lot of people were recuperating. Some people, obviously some people are complaining, some people are chill, some people are like blah blah blah. But there was this woman who, she had her, like, it's like a colonoscopy bag kind of, but she had such a soft, like, low voice that she was calling the nurse and she didn't hear her. So we looked at her and we saw her kind of like moving her arms, so we started calling the nurse, and she came over, and part of her intestine had come out. I was like, dude. And this woman, she was an older woman, and they told her, don't keep your arm flexed because it does something to your veins, keep it out. And this woman was like this the whole time, and I was like, girl, what are you doing? Anyways, oh, here's a little tip. My gallbladder stone was 29 millimeters. My whole gallbladder was 31 millimeters. So it was a huge stone, right? It was just one stone, and you could see it in the ultrasound. And what I started doing was recommended to me not by a doctor, but about a week and a half before my surgery, or 2 weeks, I started drinking with, like, the first thing in the morning with no food in my system. I would drink a spoonful of olive oil, like medical. There's like different olive oils, but it's like the medicinal one, and I would drink it, and then I would have breakfast as normal and stuff like that. Well, when the surgeon pulled out my gallbladder, he told my mom she had a lot of stones, not one huge stone, stones. So that olive oil literally combusted it and made it into tinier stones, which blessed me because as I said, I was the youngest one, but then a woman came in, and she wasn't a scheduled surgery. She was an emergency surgery, and she had the same gown as the men because she was still breastfeeding. And she got up and she was like, "Oh my god, I'm in so much pain." And the nurse who was there was like, "It's because your gallbladder couldn't come out, so they had to open up your belly button more, so it's gonna be painful." I was like, "Thank you, olive oil, thank you." So 6 hours pass. I'm totally fine. I'm very much like, I follow everything by the book. I'm very like, I believe in doctors. They'll tell me when it's time to go. But the dudes behind the side of me, they were like stressed. They wanted to leave. They were like, "Can we go already?" So this another surgeon, not the surgeon who operated us. I think he probably went home. He was like, "I've operated 11 people. I'm going home." This other surgeon came and he's like, "Okay, I'm gonna bring you one by one, but I'm gonna take out your IVs." And I was stressed. I was like, if it was painful, it's gonna be painful. And it's been 6 hours, 7 hours, 8 hours, like from 9 to 6 I've had that IV. It's gonna. And so I see him take that out, and I'm like, I'm not even gonna look. And so it's my turn, and he's like, "Oh, it's gonna hurt because you have a lot of hair." And I'm like, "Oh, thank god. If it's just gonna hurt just because of that, it's fine." I did the bad thing of looking just when that thing was coming out, so it looked a little flexed, and I was like, I shouldn't have seen that. But anyways, it came out. He told me to put on pressure, and it was fine. And then he starts bringing one by one. I'm the second one, so as I get up, I see that all the dudes who get up, you can see everything because your gown has an opening, so if you don't close it or you don't hold it, everything is shown. But me, as seeing some creepy men in here, I'm like, no. So as I stand up, I grab the other side and I grab it, and the surgeon behind me, he grabs the whole entire of my gown and just crunches it up. And when he looks down, he's like, good. So he probably sees creepy men as well, which is like, ew. And so he sits me down. He tells me to go into the same room that I changed, and he sits me down. He's like, "I'll be right back." My mom, he was like, "Look, she's here," because my mom, she literally made best friends at the clinic. Like, she stayed at the where I had been before I walked into this OR. She stayed there for like hours, just talking to the nurses, just chilling, asking it. Like, she is like the epitome of, I can make friends with anyone and everyone. That is her. So, my mom's like, "You look so much better." Like, and I did. I felt so much better. Like, it felt like I just felt so much lighter. Like, obviously I didn't move a lot, and I didn't want to see anything because I was like, I don't want to traumatize myself. Obviously, when I started putting on my clothes, I had to see it. But it took me a while, and I was still kind of woo. And you sit down and you're waiting. I would love to talk about the other two dudes, but that would make the video super long. Longer. And I'm waiting there, and so I'm like the last one to go, and they give us like a packet, right? And it has like what's medicine you have to take, how many amount of medication, X amount of hours, what diet you have to follow, what you can't do, when you have to come for your stitches, etc., etc. I'm still like, whoa. And so he tells us all this, and he repeats everything, and he's like, don't do, just like making sure that, you memorize. Plus, you also have your companion there with you to like also memorize. And then he's like, if you throw up, if you have a lot of blood coming out, do not hesitate in coming to the ER. Come to the ER. And I'm like, gotcha. So they call a wheelchair transporter. I don't know what it's called, but because you can't stand up, you can't walk away, you can't just walk up and go home. No, you have to sit down in the wheelchair, and they just take you to your car or wherever you're gonna go to, like wherever. And so I'm just waiting there. Everything's very like, wow. And I'm like, wow, I came here when it was like daylight. Now it's dark out, and this is very long. I think I'm gonna. Anyways, so that was the surgery. I feel like this video is very long, so I think I'm gonna leave it till that. I will talk about my recuperation the next video, and I'm just gonna focus on the before and the surgery on this video because it's already getting pretty long. So, but yeah, this was my surgery, and if you're getting the surgery, don't just be very chill. I know it's easier said than done, but it's not. It's a very easy surgery. It's 40-45 minutes. It's not painful, and if you do things right, aka follow your doctor's order, take your medication, you won't feel the pain. After 3 days, I didn't feel pain, and just, you will feel so much better after it. Like, literally, you will feel like something was lifted off your shoulders. You just feel so much better, and it's not that scary. And the whole IV thing, it happens to some people, it's not gonna happen to everyone. And so yeah, so this is my before surgery, and the next video that I'll do will be the after, the whole recuperation, because not this video will probably be an hour in. So yeah, this was that. So hope you enjoyed it, and if you're getting the surgery, good luck. I wish you the best, and it's gonna go amazing. Like, literally, it's an easy surgery. I was told that, and I believed it, and so you will believe it as well. So yeah, bye.